Assalamu alaikum wa rahmatullah. Today we will talk about long-term survival of adhesively luted post-endodontic restorations. This is study done by Maria Bruhnke and her group from Germany. The primary objective of this study was to evaluate the long-term survival of post-endodontic restorations with a glass fiber reinforced post. Data were compared with the controls from the randomized control clinical pilot trial investigating the survival of glass fiber post versus a titanium post. Factors affecting the success and survival served as a secondary endpoint of this clinical study. For subject population between January 2003 and April 2004, study participants were recruited for the glass fiber post 1 and titanium cohort, and between November 2006 and April 2008 for glass fiber post 2, the cohort from a patient requiring prosthodontic rehabilitation. For the treatment procedure, that all the procedure was done on by starting by caries therapy and endodontic treatment were performed by dental student, while the post endodontic restorations was done by two single operators. For patients were recalled after 12, 24 and 60 months and up to 178 months after post-insertion. Radiographic evaluation was performed at baseline, 12 months, 60 months and at the last recall. From 128 patients, the mean age was 52 years. 41 participants were recruited for the third study cohort, which is glass fiber post 2. Data were compared with the control groups, which is the titanium post group, which is 46 post, glass fiber post 1, which is 41. 20 patients, no follow-up information was collected due to the no valid contact information, which is 16, or death, which is 4 patients. For Kaplan-Meier survival graphs and the log rank test, overall mean observation time was 101 months for glass fiber post 1, 82 months for glass fiber post 2, and 95 months for titanium post group. Cumulative survival probabilities were calculated for glass fiber post 1 was 57.1%, glass fiber post 2 was 56.5%, and for titanium post was 71.8%. For failure mode in the intervention groups, for glass fiber post 1 was the most reason for failure was a fracture. For glass fiber post was the most reason for failure was a fracture and extraction for other reasons, while the titanium post shows the main reason for failure was endodontic failure. They concluded at the end that the post system had no significant impact on the tooth survival of a post-endodontic restoration after up to 15 years. Using glass fiber post or titanium post resulted in a survival rate of about 57% and 72% in the present of a long-term clinical study. And thank you so much for listening.